But you did say that the government hasn't actually shifted ground in some of these issues. Maybe people would want to know where the doctors have shifted their own ground, because matters like this would be termed as selfish in a way, because now people are suffering and people really can't place any reason why issues like appointments and knowing that hasn't actually abdicated the responsibility of the doctors in running the affairs or in the discharge of their professional duty.
Yeah, you see, the truth about it is that once you have a situation, a system that is going to complicate the seamless treatment of ailment that the patient have, it might be difficult for us to have a patient management that is proper. A system that you come to the hospital, you meet a doctor, the doctor decides to triage you, he decides who the investigation you want to do, he comes down, he makes a decision. And sometimes the doctor go ahead to do maybe surgery, and he comes the second day, and what you see is someone else is saying, no, you can't touch this, you can do this, okay? That is going to disrupt and distort the patient care. And we have...
Sorry, does that happen?
Yes, it does.
That happened once. I mean,
it's not once.
Happens to keep talking about the issue that happened at the University Teaching Hospital in Ibadan. That's the instance you're citing.
Thank you very much. No, we have so many instances. It is the instance that we want to... We can just choose any instance. As it is, let me explain to you. We have cases in which doctors, a consultant, will come to the hospital, to the ward round, and at the ward round, he expects the nurses, the other staff, professionals, to support him to go around so that they can be, everybody will know the state of a patient. And what we are having now, you get to the hospital, all the other people sit down, they sit back, the doctor does his own ward round, he writes his thing, there is no directive given, there's a lot of disjointed in the system. And this has been in place for long years.
Would you say that there's also a system for discipline? Because one would think that in a hospital environment, even for doctors who don't do their work as they should, there ought to be a committee that looks into discipline. Because one would think that there are rules guiding medical practice. And within any hospital environment, when the rules are not followed, there ought to be a way that, discipline is a disciplinary action is taken.
Certainly. Once there is a rule, once there is a law, once there is a boundary, at least we can fix everybody into his or her own perspective, or our own duty. But what we are having is that we have not a direct, strict boundary and strict rule.
What does the Medical and Dental Council do?
You are talking only about for doctors. We are talking for others. Let me give you an instance. An instance in which everybody come here, you say you want to see a doctor. We have doctor of optometrists, and the man sees you. He takes his duty and goes beyond what he needs to do. He cannot be punished by MDCN.
So which body?
What I'm saying, listen to what let me explain what I mean. What I mean is that by the time the medical doctor sees that patient, sometimes there are complications. And that time, who should you report to? If the Federal Ministry of Health, that is controlling many of these hospitals, cannot stand firm and say, look, in this instance, you cannot have more than 3 directors in a hospital, and you're having 7, 8, 9, 10, and they are incapacitated.
For instance,
it shows the level of indiscipline that we are seeing in place.
I still can remember, because this didn't just start now. There are directors of administration in a hospital. There are also director of nursing services.
Assistant director of nursing services.
So,
we are not opposed to that. What the new thing now is, anybody, once you are a degree holder, you can aspire to the height of your profession.
Okay.
Good. You can get to level 17.
Okay, but this is with the federal hospitals, federal establishments. It doesn't happen with the private sector, does it?
Private? No.
Yeah.
Private,
Why?
Most private hospitals, are being managed by doctors, and this limitation is there. Okay, it is strict.
For instance,
you can. I don't expect you when you are. Okay, let me
break it down, because
let me explain your question.
Yes, I know that we have Director of Nursing Services, and as well as
is Assistant Director of Nursing Services.
And you must retire from being an Assistant Director.
The question now is, they want to get to level 17, which is their right once they have the first degree. Now we have 15 people who wants to move to that next level. At that instance, is subject to vacancy. We just have one. Now you want everybody to move to that next level. Then it means every nurse, every other allied professional in health, when they get to that position, they get to the next level, which is maybe level 15, level 16, and they are now directors. So it means that in a hospital, we can have about 30 directors. Okay? And they can aspire and move ahead. Nobody is arguing about that. But in the hospital system, if you want to get that your directorate, our view, go to the Ministry of Health, have that directorate, because it cannot, it has nothing to add into the patient care, and it is taking medicine out of the day-to-day politics of the ministry.
Just a moment. I know that you did say that there's a lot more. I think you have about 28 reasons why you're on strike. But you did say that, you know, for you to even consider going back to work, you know, 4 or 5 of these things are the most pertinent. I do remember the NMA chairman or president making that particular demand. Am I right on that one?
No, not really. When we had our emergency delegate meeting, we have those things that we decided that should be used as litmus tests. I have stated here that the National Health Bill has been passed by Federal House of Representatives, which is part of the good things that have come out of this strike. And we have said, government has said they would do this, they would do this, they would do this, no definite issue. And we told the government in January. You were
answering a particular question.
Yes, in January.
The question I was asking is, just a moment, the 4 demands, there were 4 or 5 demands that the NMA president said must be met before the doctors go back to work. Is that correct or wrong?
I'm not sure of what you are saying. I know that they said about 5 demands that is topmost, and I think it's the reporter who chose that. But I'm telling you the decision we had at the EDM.
Who said that, you know, 5 decisions were topmost?
It was your reporter.
It was not our reporter. Perhaps we should play the report back for, this report, but the track of your NMA president or chairman who said that some conditions must be met before the doctors go back to work.
Let me explain. We have.
Did you or did you not say that?
I said that 5 demand is not from NMA.
It's from who?
I don't know where your reporter got it. But we have, when we resolved at the EDM, NMA found that the government was not sincere. If he has written a circular by 3rd of January and up to today, he has not done that. What we said is that if you have done that, resolve it. If you are saying that the NMA president came out and said that implement that circular before we have to move and shift ground. That is based on looking at things that has occurred.
Are these demands, these 5 demands at least were enumerated by our reporter, whom you say that, you know, has chosen certain things from, you know, and I very strongly say that that is not true, because I do remember your NMA chairman saying that there were these conditions must be met, this first 4 or 5 must be met before you go back to work. Are these topmost?
Maybe is it even on cue?
Oh,
if they want to listen to it.
Perhaps we should listen to it.
Okay.
Delegates meeting of the Nigerian Medical Association that met last Saturday has directed all doctors in the country to down tools as from 0010 hours of the 1st of July 2014.
Ripple effect. effect of this directive by the president of the Nigerian Medical Association, Dr. Kayode Obembe, is now being felt in public hospitals.
Well, that wasn't the exact one, so mix up that. But
what I'm trying to say is that after our EDM, we observe that if the government is coming down with these promises that they have always been coming down, there are some things that they have to do. Okay? It's not a fresh demand. One, the January 3 circular that they have given, that they have not effected, at that meeting that we had last Monday, they told us that we have to wait for another 3 months before they start effecting it. I said, look, before we can listen to any other promise or issues that you want us to believe in you, you have to do that. We have not prioritized and said these are the things that we must have, that is the topmost 5.